Hi everyone. Just thought I would touch on a couple of things, my little pet hates today, and hopefully they resonate with you and help you out a little bit in terms of just kind of sorting out some confusion that's around in the industry quite a bit. So I wanted to talk to you about scans. So whether we're talking about X-rays, MRIs, CT scans, ultrasounds, doesn't matter. Scans in general, and where they fit into physiotherapy. So my personal opinion on getting scans, I'm asked quite a lot in terms of, should I go and get a scan? And my thought is, there is a risk to having scans, okay? So some scans like MRIs, you can't go and have an MRI if you have any metal implanted in your body. It's a huge magnet. So you try and use your imagination in terms of what's going to happen to metal that's inside of you when you're surrounded by a big magnet. It wants to get out of you. That could be quite unpretty. Then looking at other types of scans, you're looking at radiation. Now some of those scans have got quite a low level of radiation, some have got a higher level of radiation. But if we can avoid that radiation, without having a needless scan, then we should avoid it. Okay, so that's kind of where I sit. My answer to most people, if they ask me if they need a scan, is it going to change our management? So what do we think it is right now? And is getting a scan going to change our management of that condition? Without getting a scan, are we going to miss something that's potentially life-changing or life-threatening? And if so, obviously we need to go and get the scan. I am not saying there should be a blanket rule against doing scans. I just think we over-prescribe scans, X-rays, CTs, MRIs, ultrasounds, etc. Okay. The reason why is because I think we fall into the trap of we treat a scan. Whether that's through the physio, the GP, the surgeon, we treat the scan. And the reason I want to share with you today why we shouldn't treat the scan is because there's things called false positives. Okay, so what's a false positive? Let me draw you a little picture and I'll explain to you what a false positive is. My little whiteboard out again. Okay, so if we break things up into four. So we've got positive, 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 negative, and negative, positive, and a negative, negative. Okay, so these are basically confirming. Okay, so we found a result, and what we've found is actually the cause of your pain. For instance, you fall over and break your leg, and you have pain in your leg. We take an X-ray, and we find a broken bone. Positive, positive. We're finding what is the cause of your pain, okay? False positives, so when we find a positive but it's actually negative, is a little bit harder to understand. And so if I can just refer you to a couple of studies that were done back in the 90s, what they did is they scanned people who were asymptomatic, so no back pain, okay? What they found that 20% of people over 60 who had no back pain, zero, no back pain, never had back pain, didn't currently have back pain, had disc herniations. So they found a disc herniation on scan, okay? But they had no pain. So you go, well, is that really a big deal? They didn't have pain, so who cares that they had a disc herniation? But what it then leads us to think is, if you do have back pain or you do have leg pain and you have a scan and it shows up positive for a disc herniation, if you can have a disc herniation and have no pain, is that disc herniation the cause of your pain? And that's the question. Okay, so what would happen if we treat the scan is we treat the disc herniation or treat the disc bulge. But then what happens if that's actually not the cause of your pain? We're not actually treating the cause. The cause might be a number of things. It could be muscle spasm. It could be postural. So it could be that we're getting compression through a nerve. It could be that we're getting compression through a joint. It could be movement related. So it could be, a lack of proper movement, a lack of core stability while we're moving that's causing compression on structures that are giving you pain. Nothing to do with a disc herniation. This is really, really close to my heart, because if you were to look at my scan of my back, which I haven't had one done for years, I have a shocking scan. It looks really ugly. I would not be hanging it on my lounge room wall as a pretty piece of artwork. It is really quite horrible. I've got 2 discs in the bottom of my back that are completely degenerated and completely compacted, and I think that they might have naturally fused. It looks pretty ugly, but I actually don't get back pain. On a daily basis, I do not get back pain. I get back pain sometimes, but it's got nothing to do with those discs. It's actually got to do with the ramifications of that. So muscle spasm, muscle overuse, stiffness, those kinds of things. Because if we look at the scan and say, well, you've got 2 degenerative discs, we can't do anything about that. Apart from replace those discs and have surgery, I can't do anything about the state of my discs. However, if I was to approach my treatment like that, oh well, I've got pain, I can't do anything, it's pointless. If I then approach it differently and say, well, maybe that disc degeneration is not the cause of my pain, it then gives me access to then start searching for other reasons for my pain, that then gives me access to being pain-free, which I am on a daily basis. Okay? So today I just want to invite you to, if you have had a scan on an injury and it's shown up something you're not that happy about, because generally if things come back positive on a scan, you're not that happy about it, look at it differently. Don't treat the scan, treat you as a person. Let's look at different reasons for your pain, your stiffness, your lack of function. Let's look at you as a whole human being rather than treating a scan. If you know someone who's in the same position, who has had a scan and is, it doesn't necessarily have to be back pain. This can relate to having a scan on a hip or a knee that's shown arthritis, and oh well, you need to go and get a total joint replacement. There's lots of things that we can do to stretch out the amount of time between the present day and having to get that joint replacement that isn't shown on a scan, that isn't shown on an x-ray. Is the degeneration still there? Absolutely. But can we make a difference to you as a person in terms of your pain, in terms of your daily function? And I think that's really, really important. So if you know of anyone, or you yourself have had a scan and this really strikes a chord with you, and you feel like you have kind of given up because of what a scan has said, please feel free to reach out, touch base with me, send me a PM, send me a text, send me an email. Even if you wanted to send those scan results to me so that I can have a look over them, I'm more than happy to do that. And then you can come in. You can even come in for a free assessment. So what I do a 10 to 15 minute assessment that I call a pre-assessment. So it's the assessment you have before you have an assessment, to actually see if there's something we can do to help you. So it's a really, really short little window. Have a quick look at your scans, do a couple of quick little tests to see if the reasons for that pain are something other than what's showing up on that scan. We can come up with a bit of a plan as to whether physio would help you, and if not physio, then is there something else that can help you? For instance, visiting a podiatrist to get some orthotics, or getting a second opinion from another surgeon for a less invasive surgery. Those kind of things we can help you out with. So feel free, drop me a message any way you like, and I'm more than happy to look at those things. And remember, you are not a scan. You are a person, and that's the way that you should be treated. So, short one for today. I hope it's been really helpful. Shoot me a message below with any questions. Like I said, any specific questions about your particular circumstance. Private message me or send me a text So the number is 0411070767. Feel free, send me a text or an email, and I will have a look over those scans and see what we can do to help. So have a great day, everyone, and I'll see you next week. Ciao.